सभी लोग कैसे हैं? हाउ आर यू एवरीवन?
वेरी
आपकी दुआएं हैं
गुड
सब।
इवनिंग सर।
फाइन सर, थैंक यू।
यो भी समझ में आ रहा है थोड़ा थोड़ा।
थोड़ा थोड़ा समझ में आ रहा है, थोड़ा कंफ्यूजन हो रहा है।
कंफ्यूजन दूर हो जाएगा धीरे धीरे।
आप कैसे हो सर?
मस्त, सुपर। तो टुडे आई एम थिंकिंग टू कंप्लीट द endocrine glands because the discussion is still pending, right? So let's start. So quickly I will show you this chart. Like we know there are 8 extraordinary vessels and every one is having one master point and the couple point. सभी के master point और couple point है. And if we look at the another chart, अगर हम दूसरा chart देखें, the very important chart, and just to see the connection with the endocrine glands, look at this chart. every extraordinary vessels having connection with the endocrine glands. Every vessel is having path. Like we are very much aware with the Ren Mai. हम जानते हैं कि Ren Mai का एक path होता है. Ren Mai meridian, CV meridian, CV1 से start होता है, CV24 पर खत्म होता है. So Ren Mai starting from CV1 to CV24. In the same way, we know there is a path of the DO meridian. DO meridian का भी path होता है. In the same way, there is a path of Chong Mai, Dai Mai, Yin Koi Mai. Each and every extraordinary vessels having path. So right now, our focus, their connection with the endocrine glands. So let's go quickly. So this is the connection. It is given here. The each and every endocrine glands having connection with the some EOV. In the previous class, we already have discussed about the Ren Mai. हमने Ren Mai के बारे में discuss किया था कि the master point of the Ren Mai is lung 7 and the couple is kidney 6. So if you want to activate the Ren Mai, put the lung 7 on the master side and the kidney 6 on the opposite side, and the Ren Mai is having connection with the anterior pituitary. और हमने ये समझा था कि anterior pituitary is a very important. So the Ren Mai is having connection with the anterior pituitary and the Du Mai is having connection with the posterior pituitary. So the Ren Mai, the master point is lung 7 with the couple point kidney 6 and the Du Mai master point is SI3 with a couple point urinary bladder 62. तो आप आगे की प्रॉब्लम को ठीक करना चाहते हैं Ren Mai को ले लीजिए और पीछे की प्रॉब्लम को ठीक करना चाहते हैं आप Du Mai को ले लीजिए. So person is suffering with the problem with the face, chest, throat, abdomen. In the front side, take the Ren Mai. Person is having problem on the back side, take the Du Mai. So anterior pituitary is very important if you want to read the thyroid, Ren Mai, because the TSH secreted by the anterior pituitary. If you want to work on the FSH, LH, that is the genital hormone, Ren Mai. If you want to work on the growth hormone, if you want to work on the prolactin hormone, if you want to work on the adrenal hormone, adenocorticotrophic hormone, you have to work on the Ren Mai. We already have discussed in detail, so I'm not going again in the detail of this. You can see the previous video. Right now, my focus, if you want to treat the thyroid, you want to treat the TSH, you have to treat the Ren Mai. So the master point will be lung 7 and the couple point will be kidney 6. In the same way, you can plan for each individual. आप एक हार्मोन के लिए प्लान कर सकते हैं. मिल्क हार्मोन मींस प्रोलैक्टिन, ग्रोथ हार्मोन हु इज इंड्यूसिंग योर ग्रोथ, जो आपकी ग्रोथ को बढ़ाता है, लंबाई को बढ़ाता है. FSH, LH रिस्पॉन्सिबल फॉर फर्टिलिटी and sexual behavior, TSH, thyroid hormone, and ACTH, who is stimulating adrenal gland. These all are secreted by the anterior pituitary. Okay, इन सभी का secretion हमारे anterior pituitary से होता है, which can be activated, stimulated by Ren Mai. So any disharmony in the any hormone, we can work with the Ren Mai. So the master point lung 7 will be on the dominant side. For the male, it will be on the left side, the master point. And the couple point kidney 6 will be on the opposite side. In the female, the master point will be on the dominant side, which is the right side, and the couple point on the opposite side. We have already discussed. For completing the pattern, we will add lung 7, kidney 6, and CB1 for female, lung 7, kidney 6, and stomach 30 for male. Okay. Okay. Now let's talk about the. I will tell you, we have to discuss a little more detail about the Ren Mai, but right now we are going quickly for all the endocrine glands. The next endocrine glands is adrenal gland. हमारी अगली जो endocrine glands है, उसका नाम adrenal glands है, and adrenal gland is having connection with, as per this chart we can see, the adrenal gland is having connection with yin B Mai. B means connection, B means linking, or the yin linking vessel. Okay, so let's talk about the adrenal gland. You want to activate the adrenal gland, the master point will be pericardium 6 with the couple point is spleen 4. So focus on the pericardium 6 first. आप adrenal gland को activate करना चाहते हैं, आप adrenal gland को stimulate करना चाहते हैं, आप adrenal gland के हार्मोन बढ़ाना चाहते हैं. You want to stimulate the adrenal gland, the master point will be pericardium 6. So let's see here. So look at here. Suppose this is the kidney, ये हमारी kidney है. This is the kidney, right? This is the one kidney and this is the another kidney. There are two kidneys, right? So we can see both kidneys, kidney 1 and kidney 2. And above the kidney, we are having the adrenal gland, which is also called the cap of kidney. जिसे हम किडनी की कैप भी कहते हैं, वह है हमारी एड्रीनल या सुप्रारीनल. किडनी को रीनल कहते हैं और उसके ऊपर की ग्लैंड को बोलते हैं सुप्रारीनल ग्लैंड, सुप्रारीनल और एड्रीनल ग्लैंड, जिसे रीनल से ऐड कर दिया है. नाउ एड्रीनल ग्लैंड is having 3 parts. So we are understanding GFR. The outermost covering of the adrenal gland is G. The middle covering of the adrenal gland is F. And the inner covering of the adrenal gland is R. So suppose this is the adrenal gland. We can consider the outermost covering is G. And the second covering is F. And the inner covering is R. So adrenal gland is having 3 covering, that is called GFR. G will increase BP, F will increase sugar, and R will increase sex hormone. I will explore this. पहले आपको मैं एक मोटे रूप से समझा रहा हूं कि जो आउटर मोस्ट लेयर है वो बीपी बढ़ा देगी, उसके अंदर की लेयर है जो शुगर बढ़ा देगी, और सबसे अंदर की लेयर सेक्स हार्मोन बढ़ा देगी. So stimulation of the adrenal gland is increasing the BP, so good for low BP patient. Increasing the sugar, so it is good to stimulate the adrenal gland for the patient suffering with low sugar. And also we can stimulate to improve the sex hormone, especially male sex hormone. Male sex hormone, it will increase the male sex hormone, right? So we can also understand this. Suppose this is the adrenal gland. And I told you the adrenal gland is having 3 covering. This is the outermost covering, which is G. Then the second covering, which is F. And the inner covering, that is R, GFR. GFR. All together are called adrenal cortex. adrenal cortex, means the outer part of the adrenal and the central part is called adrenal medulla. हम adrenal के center part को क्या कहते हैं? Adrenal medulla. Right? So now I will explore this little. Now GFR. So G means glomerulosa. Glomerulosa. GF. So we are telling it zona glomerulosa. I will show you here. So we can see here, this is the outermost part of the adrenal gland. This is the outermost part, which is the adrenal cortex. And the inner part is adrenal medulla. Let's see here. So what is written here? Zona glomerulosa means G. G means glomerulosa. Then zona fasciculata, F. Then zona reticulata or reticularis, that is R. So I told you the G will increase BP, F will increase sugar, and the R will increase male sex hormone. It's written. When we talk about the G, how it increases the BP? It increases the BP. जैसे BP कैसे बढ़ता है? एक पानी का ग्लास है, पानी के ग्लास में नमक डाल दो तो पानी का वजन बढ़ जाएगा. घोल दो, नमक घोल दो. If you suppose this is a mineral water and this is a simple water. In the mineral water we have minerals, so it is having more weight. Like you can see simply, suppose आप कहीं पर ऐसे पानी डालो, you throw the water, और पानी में थोड़ा सा कुछ मिला दो, थोड़ा नमक मिला दो, शक्कर मिला दो, रेत मिला, कुछ मिला दो जो घुल जाए पानी, और फिर पानी को मारो तो पानी का वजन ज्यादा होगा. The water having more weight. So in this way, the first part that is called zona glomerulosa, the outermost covering of the adrenal gland, that is increasing the minerals. ये मिनरल की मात्रा बढ़ाता है, राइट? पानी में, ये पानी को, हमारे जो ब्लड को, जैसे कहते हैं ना पानी में मिनरल डाल दिया तो मिनरल वाटर बन गया, ऐसे हमारे ब्लड को ये मिनरल ब्लड बनाता है. So the zona glomerulosa is increasing the minerals. So zona glomerulosa secreting one hormone. The name of that hormone is mineralocorticoid. Mineralocorticoid. काम क्या है? To improve the minerals. The zona fasciculata is secreting hormone that is called glucocorticoid. What is the work? To increase the glucose. Glucose को बढ़ाना. Right? Zona reticulata secreting male sex hormone, androgen. So that is increasing the masculine nature. Masculine nature. So that's why it's written mineralocorticoid. That is mineralocorticoid increase blood pressure while increasing the minerals like sodium, potassium, many other minerals. Glucocorticoid increases the blood sugar by increasing the sugar level. And the third, androgen or the testosterone, is increase the masculine nature. अब ये बताइए मुझे कि फीमेल्स में एड्रिनल ग्लैंड होती है कि नहीं होती? Whether female having adrenal gland or not having. Suppose if the adrenal gland is overstimulated in the female, and if the third one, GFR, that is secreting more male sex hormone in the female, what will happen? अगर फीमेल में एड्रिनल ग्लैंड ओवरएक्टिव हो जाए और ज्यादा मात्रा में मेल सेक्स हार्मोन का निर्माण करे तो क्या होगा? तो फीमेल की दाढ़ी निकल आएगी, chin hair, body hair. So like we are having many diseases like PCOD. You know PCOD? In the PCOD, why the female having more hair? Because of this adrenal gland secreting more male sex hormone. right? So male sex hormone is not only secreted by the testes. मेल सेक्स हार्मोन सिर्फ मेल के टेस्टिस में नहीं बनते, वो एड्रिनल ग्लैंड में भी बनते हैं, मेल फीमेल दोनों में. That's why the female suffering with the PCOS having more male sex hormone because of the overstimulation of the adrenal gland, right? So she is having body hair. In the same way, if in male, some male is not getting hair, this hair is not getting, you can stimulate the adrenal gland. You can increase, some male is having development like gynecomastia. किसी मेल को ब्रेस्ट जैसे डेवलप हो रहा है, उसकी छाती फीमेल जैसी हो रही है. द मेल इज हैविंग less androgen, less male sex hormone, then we can stimulate the adrenal gland. Some low BP patient is coming to you. Some person is suffering with the dehydration. जब हम dehydration के शिकार होते हैं, जैसे किसी को डायरिया हो गया, the person is getting diarrhea and going to the hospital. Then doctor is giving drip. What is drip? Drip is some minerals and some concentration of the ions and all. Okay. We can stimulate the adrenal gland and we can increase the blood pressure. So that's why it's not good to stimulate the adrenal gland if the pressure is already high. अगर मान लो किसी का प्रेशर बढ़ा हुआ है और आपने स्टिमुलेट कर दिया तो प्रेशर और बढ़ जाएगा. So let's see this chart. So there are adrenal cortex. I told you the adrenal cortex is first layer, that is increasing the sodium ion. The second layer, increasing the blood glucose. This is the effect. So adrenal cortex can increase the sodium ion and the blood pressure. Adrenal cortex also increase the blood sugar. So because this is secret mineralocorticoids and the glucocorticoids and they are steroid. इन्हें कहते हैं steroid. इसका मतलब है कि हमारी एड्रिनल ग्लैंड स्टेरॉइड का निर्माण करती है. यही कारण है कि जब कोई व्यक्ति बाहर से स्टेरॉइड लेता है तो उसका बीपी बढ़ने लगता है. द पर्सन इज हैविंग taking the steroids, maybe because of some reason, maybe because of rheumatoid arthritis, maybe because of some other problem, maybe some because of the fever or anything, because of anything. You know, steroids are very common. Doctor are giving or not? Steroid देते हैं कि नहीं देते? Dexamethasone, prednisolone, there are many steroid doctor gives. So doctor asks first, do you have BP? Do you have sugar? If you tell yes, oh, let me give something else. Because if you are having already BP, already sugar, and if you take the steroids, they will raise your BP, increasing the sodium ion concentration. They will raise your blood sugar, diabetes, if the person is already having, right? तो इसीलिए जब डॉक्टर स्टेरॉइड देते हैं तो लोगों का बीपी बढ़ने लगता है. द पर्सन इज टेकिंग द स्टेरॉइड सिंस लॉन्ग टाइम. यू कैन सी he suffer with the high blood pressure, he suffer with the diabetes. Person is taking steroid for longer time, even suffer with the, if female is taking steroid for longer time. अगर फीमेल ने स्टेरॉइड ज्यादा समय के लिए लिया तो क्या होगा? If the female is taking steroid for longer time, many females are taking because of the various diseases, or male, female, anyone, it will increase the high blood sugar, it will increase the blood pressure. It is clear or not? Clear. So how to activate the adrenal gland? Suppose किसी का low constitution है, कोई व्यक्ति कमजोर है, कोई व्यक्ति dehydrated है, the person is dehydrated, the person is low, person is having low BP, then how to activate the adrenal gland? We can activate the adrenal gland by the pericardium 6. The pericardium 6 as a master point is very good for adrenal gland. Means if you stimulate the yin linking vessel or the yin Mai, means the master point is pericardium 6, it will activate the adrenal gland. अगर किसी का BP low हो रहा है, you can put the pericardium 6 as a master point and the spleen 4 as a couple point, right? जैसे किसी मेल का BP low हो रहा है, the person is having low BP or the low sugar, if male, we can put pericardium 6 on the left side. It will activate the adrenal gland and will raise the BP. Suppose you are doing the treatment in a clinic and suddenly person is suffering with a hypoglycemia, किसी patient को एकदम से sugar down हो गया, BP down हो गया. Immediately you put pericardium 6 tonification on the dominant side and you will increase the BP. So whether we can put for the high blood pressure patient, क्या हम पेरिकार्डियम 6 को हाई बीपी पेशेंट के लिए लगा सकते हैं क्या? थोड़ा बचना चाहिए, डोमिनेंट साइड में मत लगाओ. हालांकि अननोइंगली हम लगाते रहते हैं, बट सपोज इफ द पर्सन इज ऑलरेडी हैविंग हाई ब्लड प्रेशर and you want to put the pericardium 6, don't put in the dominant side. What is the dominant side for male? It is the left. We can put on the other side, that is the right side. आपको मानो किसी मेल पेशेंट को बुधा ट्रायंगल लगा, बुधा ट्रायंगल भी नो. What is Buddha triangle? Tell me, what is Buddha triangle? Buddha triangle is a combination of 3 points, which is very good for brain. That is, one point is pericardium 6. Buddha triangle means 3-point combination. It's very good for brain. So we know here lung 9, heart 7, and pericardium 6. These 3-point combination. So this is called Buddha triangle. It's a wonderful, excellent for, ये बहुत ही शानदार है किसके लिए? मन के लिए, मेमोरी के लिए, इंसोम्निया के लिए, तनाव के लिए, टेंशन के लिए. Buddha triangle is very, very effective for all unwanted emotions, anxiety and all. It's clear? Okay. So now, be understood now. If the patient is suffering with a low BP, we quickly will increase the minerals in the blood, sodium in the blood, and will increase the BP. So done. Next. Now we are coming to the posterior pituitary. We already know posterior pituitary. The master point is the posterior pituitary is connected with Mai, and the master point is SI3. The posterior pituitary is secreting oxytocin and the ADH. Oxytocin responsible for uterine contraction. Oxytocin का संबंध हमारी uterine contraction से है. Okay, so Mai is also controlling the backside. हमारे शरीर में अगर हमें ऑक्सीटोसिन की मात्रा बढ़ानी हो, ADH की मात्रा बढ़ानी हो, we want to increase the ADH or oxytocin, we can activate the Mai or SI3. If we already have discussed this, we have discussed now. Remember everyone? हम Mai का थोड़ा तो डिस्कस कर चुके हैं ना. अभी डिटेल में तो बाद में किया जाएगा, अभी हम वही थोड़ा थोड़ा डिस्कस कर रहे हैं. So you want to activate the Mai. How to activate the Mai? SI3 on the dominant side and urinary bladder 62 on the other side. One person, male person, is suffering with the pain around the spine. Upper back pain, middle back pain, lower back pain. Any problem in the back side, we can always stimulate posterior pituitary or Mai. Because Ren Mai आगे को कंट्रोल करता है और Mai पीछे को कंट्रोल करता है Mai. So in the male and female both, we can use SI3 as a master point and urinary bladder 62 as a couple point, right? And one very special formula, suppose one male person is suffering with lower back pain and feeling cold in the body, उसे शरीर में ठंडा लगता है, तो हम डू माई को एक्टिवेट कर सकते हैं. डू माई इज द यांग चैनल. डू माई विल इंक्रीज द यांग फोर्स. So SI3 tonification is very, very effective to increase the yang. What is the meaning of yang? Two things. Number one, circulation. Number two, heat. Yang का मतलब है circulation, yang का मतलब है heat. So as soon as we activate the SI3, we will be improving the circulation. We will improve the heat. Can you tell me what is the benefit to improve the circulation? SI3 को लगाया, circulation improve हो गया. SI3 for the male on the dominant side, for the female on the dominant side, for the male on the left, for female on the right. As soon as you put the SI3, it will improve the circulation. What is the benefit of circulation? Circulation का सबसे पहला benefit कि यह है, yes, very good, retention को दूर कर देगा. कहीं पानी जम गया होगा तो उसे फिर से पानी बहना चालू हो जाएगा. The person is having swelling around the knee. Person is having swelling around the anywhere in the body. It is called water retention. As soon as you put the SI3, it will come in the flow. So SI3, one of the great points to improve the circulation. Why? Because it is a master point of डू माई. ये हमारे डू माई का मास्टर पॉइंट है, राइट? हमारी SI3 का बहुत ही गहरा कनेक्शन है हमारे पानी के बहाव से, पानी के सर्कुलेशन से. Okay. SI3 is very much deeply connected. So one person is telling you, can you treat my lower back pain? Can you treat my knee pain? Can you treat my upper back pain, middle back pain, lower back pain? And person is also telling, I am feeling very cold. Okay. Cold means cold hand, cold leg, cold body. आप समझ गए इसके अंदर यांग की डेफिशिएंसी हो गई है. As soon as you put the SI3 urinary bladder 62, you will see quick result. Okay. Neck, upper back, middle back, lower back. Okay, wonderful. So now if you want to create more effect in the male and female, I already told you one formula. This is the formula. For the male, you want to work on the entire back. SI3, UB62, add DU3, K3, UB23. 3, 3, 3. DU3, K3, UB23. They will complete the pattern and person will be having wonderful results in the pain happening anywhere in the spinal area. कहीं भी पेन होगा ऊपर से नीचे स्पाइन में, कमर में, we will see the immediate effect. So put the SI3, UB62 and 3, 3, 3 for the male. And because female are having very important structure, that is uterus, and we want to work on the female spine, we can't forget uterus. हम female के uterus को नहीं भूल सकते, because uterus is having very great impact for the spinal health. So that's why SI3, UB62, lung 7 and kidney 6 is a very wonderful circuit for the female. And as soon as you put it, you will see wonderful effect in the upper back pain, middle back pain, lower back pain. And we can use DU3. Sometimes even I also add 3, 3, 3 here also. It's give good results. DU3, K3, UB23. But for female, the added point, lung 7 and the kidney 6, lung 7 kidney 6 को add करना बहुत जरूरी है females के लिए, because of uterus. Many times, little bit disharmony in the uterus create responsible for the lower back pain. Many female are having irregular menstruation. अभी हम देखेंगे आगे चल के कि कैसे हम irregular menstruation को lung 7 से ठीक करते हैं. मेनोरेजिया, मेट्रोरेजिया, कम ज्यादा ब्लड का निकलना, ओके, ब्लीडिंग का कम ज्यादा होना, समय पे ना होना, पहले होना, ज्यादा होना, पेन के साथ होना, इन वी आर यूजिंग रेन माई लंग 7. अगर किसी का यूट्रस निकाल दिया तो 100% आपको यूज करना ही है. इफ द यूट्रस इज रिमूव्ड, देन डू नॉट फॉरगेट टू यूज लंग 7. Okay, so SI3, UB62, lung 7, kidney 6, and 3. It's a wonderful for activating the Dumai, activating the yang force, energy, circulations, स्वेलिंग को हटाने के लिए, वाटर रिटेंशन को हटाने के लिए, कमर का दर्द मिटाने के लिए, ये बहुत ही शानदार फॉर्मूला वी ऑलरेडी हैव डिस्कस, सो आई एम मूविंग क्विकली. नाउ वी आर कमिंग टू द पैंक्रियाज. पैंक्रियाज इज वेरी important structure. So quickly, first I will tell you, in the EOV, in the extraordinary vessels, kidney 6 is the point who is activating your pancreas. Kidney 6 are yin heel vessels or the yin Chong Mai. We already have seen in this chart, हम इस chart में देख चुके हैं. Let's see here. This is the chart. In this chart, it is very clearly mentioned pancreas is activated by yin Chong Mai, yin heel vessel. The master point is kidney 6. It means if you work, you're working on the kidney 6. अगर आप kidney 6 पर work करते हैं, then you are able to activate the pancreas. Right? We can see this is the location of the kidney 6. It's a very important point. The kidney 6 is 1 chin below from the medial malleolus and very effective point for pancreas as per EOV, the master point for pancreas. And lung 7? Lung 7 is the couple point. तो lung 7 को ढूंढने के लिए बहुत शानदार तरीका है. Lung 7, you know, we are doing like this. Doing like this. So where my index finger is reaching on the bone, ये bone है, bony part, that is the lung 7. Lung 7 neither this side nor this side. Lung 7 on the border. Lung 7 found in the bone, or we can measure 2 fingers from the wrist. This is the lung 7, this is the couple point. So now you want to activate the pancreas, you want to work for the person who is suffering with some pancreatic issues, then you have to activate this. Now, regarding the pancreas, so let's see here. Pancreas is the very important structure. So suppose this is the pancreas, ये आपका पेट है इधर, और मानो कि यहाँ पर है pancreas. ये pancreas है ना? So the pancreas is having many cells. In the pancreas we have, the pancreas is having 2 parts. Exocrine part and the endocrine part. Exocrine part secreting enzymes and endocrine part secreting hormones. So that's why pancreas is called mixed gland. इसीलिए हम pancreas को mixed gland कहते हैं. We know there are many enzymes secreted by the pancreas, LAT, lipase to digest the fat, amylase to digest the carbohydrate, trypsin to digest the protein. There are many enzymes secreted by the pancreas, right? But if we see the endocrine functions, we already know pancreas play a very important role in the very famous disease that is diabetes, that is due to the endocrine impairment. Pancreas is definitely helping in the digestion. It is helping in the digestion of fat. It is helping in the digestion of carbohydrate. It is helping in the digestion of protein. This is the one aspect. कि pancreas हमारे फैट और कार्बोहाइड्रेट प्रोटीन को तो पचाता ही है, ये तो इसका एक तरफ हुआ. लेकिन दूसरी ओर ये एंडोक्राइन ग्लैंड्स भी है. pancreas secreting many hormones. Like in the pancreas, suppose this is the pancreas secreting many hormones. The endocrine part of the pancreas secreting in the alpha cell, beta cell, delta cell. There are many cells, alpha, beta, delta. There are many cells. They are secreting the hormones. Okay. So let's see here. You can see in this image alpha cell secreting glucagon, beta cell secreting insulin, both are just opposite. दोनों एकदम अपोजिट हैं। जैसे कि मानो कि ये पैंक्रियाज ने दो हार्मोन बनाए, एक बनाया ग्लूकेगॉन और एक बनाया इंसुलिन। द पैंक्रियाज मेकिंग टू हार्मोन, राइट? सो ग्लूकेगॉन इज breaking stone and making sugar. ये पत्थर को पिघलाकर शक्कर बनाता है। पत्थर यानी जो शक्कर के बड़े बड़े पत्थर बन, शक्कर का जो डिपोजिट हो जाता है। सो ग्लूकेगॉन इज रिलीजिंग द सुगर, रिलीजिंग सुगर। It will work on the liver, it will work wherever sugar is stored, it will break and will release the sugar. So there will be more sugar in the blood, more sugar in the blood. It is very important hormone because sometimes you are working a lot, you need sugar, you will get with the help of glucagon. But insulin is doing opposite work. Insulin is doing the judgment of the blood, blood में जाएगा and blood sugar को जमा कर देगा, like in the liver or in the other place. So insulin is responsible for deposit, right? So they are just opposite. इंसुलिन ज्यादा होगा तो क्या होगा? इंसुलिन ज्यादा होगा तो बैंक बैलेंस बढ़ता जाएगा, क्योंकि इंसुलिन का काम है कि कितना रुपए है, 1000 रुपए है, 900 रुपए बैंक में जमा कर दो। कितना है, 500 है, 400 बैंक में जमा कर दो। दिस इज द वर्क ऑफ इंसुलिन. So more the insulin, more the deposit, more the insulin, more the deposit. Sometimes there too much insulin, then person is having too much deposit. That's why it is told more the insulin, more the weight. जितना इंसुलिन ज्यादा होगा उतना व्यक्ति मोटा हो जाएगा, फैटी हो जाएगा. Nowadays people are suffering with the insulin resistance, obesity. ग्लूकेगॉन क्या करेगा? ग्लूकेगॉन फैट को पिघलाकर शुगर बनाएगा. इट्स क्लियर? ओके. सो नाउ लेट्स सी हियर. अब यहां पर देखिए. सो वी अंडरस्टूड द एक्शन ऑफ दीज टू हार्मोन. हमने इनके बारे में समझा. लेट्स सी हियर. सो अल्फा सेल प्रोड्यूस ग्लूकेगॉन हार्मोन which increases blood sugar. Beta cell produces insulin hormone which reduces the sugar. Both are just opposite. और डेल्टा सेल क्या करेगी? डेल्टा सेल बोलेगी तू भी चुप एंड तू भी चुप, दोनों चुप हो जाए. सो डेल्टा सेल सीक्रेट सोमेटोस्टेटिन हार्मोन जो दोनों को इनहिबिट कर देगा, क्योंकि कभी कभी ऐसा होता है हमें जरूरत नहीं है. So the body intelligence is very, very excellent. Sometimes they need glucagon, sometimes they need insulin, sometimes they don't need anything. That time delta cell will be activated. In this way, there are many cells in the pancreas and they are working. Now you want to activate the pancreas. आप pancreas को activate करना चाहते हैं. Pancreas is not working properly. Kidney 6 is the master point. That's why kidney 6 is very good for digestion also. Because as soon as you put the kidney 6, there will be good secretion of the lipase, amylase, trypsin. You will able to digest the fat, carbohydrate, protein, and you will able to maintain the function of the pancreas, endocrine function of the pancreas. Kidney 6 is very good point for digestion also. अगर किसी को पेट में गैस बन रही होगी, kidney 6 पर दर्द मिलेगा. It is clear or not? So what we can do, kidney 6 as a master point and the lung 7 as a couple point. Couple point we can add. So one person is suffering with any type of the disharmony, whether this disharmony of the enzymes, person is having difficulty to digest the fat, carbohydrate or the protein. Person ने घी खाया और सेम घी निकल गया उसके स्टूल में. उसने जैसा घी खाया था वैसा का वैसा घी उसके पेट से निकल गया बाहर. मतलब फैट नहीं पच रहा है, यानी पैंक्रियाज गड़बड़ है. Pancreas having some problem. Person is not able to digest the protein. or person is not able to digest the carbs, want to improve the pancreas and will activate the kidney 6. Pancreas is not secreting enough insulin, person is suffering with the diabetes. We want to balance the pancreas, we will work on the kidney 6, right? So kidney 6 one of the great point for activating the pancreas. हमारे pancreas को balance करता है, इसके endocrine और exocrine functioning को normal करता है, kidney 6, right? So let's see here. So kidney 6 as a master point, and the lung 7 is a couple point in the male. Suppose some male is having indigestion problem, we can work with this. Some male is having some problem which is connected to the pancreas, sugar impairment, we can work with this, right? Most of the time, we can use these points for diabetic persons. हम diabetic person के लिए use कर सकते हैं. Most of the time, we can work on the insulin by this point. For the female, we can work with the kidney 6 on the right side, on the dominant side, and the lung 7 on the other side. I think it's clear now. Can we proceed? It's clear now. Clear? Shall we proceed ahead? Yeah. Now, very important, very, very important. Chong Mai, excellent. We already have discussed, but I would like to discuss once again. Chong Mai. Chong Mai, the master point is spleen 4 with a couple point pericardium 6. The Chong Mai is having connection with the testes and the ovary. We know testes and ovary are responsible for maintaining the reproductive functions. हमारी दाढ़ी मूछ निकलना, फीमेल्स को समय पे पीरियड का आना, फीमेल्स में लंबे बाल, मेल में दाढ़ी, समय पर पीरियड्स का आना, ये सब हमारे हार्मोन से होता है. So all menstrual functioning are under control of the hormones. If person is suffering with any type of the hormonal problems which is connected to the testes or the ovary, we will stimulate the spleen 4. That's why spleen 4 is one of the great point for polycystic ovary. Polycystic ovary के लिए बहुत ही शानदार point है. Infertility, polycystic ovary. So the master point will be spleen 4 and the couple point will be pericardium 6. Right? It's a very good for the male if we want to balance the male sex hormone. अगर हम male के sex hormone को balance करना चाहते हैं, we want to improve the fertility of the male. We want to work on the erectile dysfunction for the male. अगर हम male के किसी भी तरह के sexual problems पर work करना चाहते हैं, we can use spleen 4 and pericardium 6. If we want to work on the female, so the spleen 4 will be on the right side, master side, and the pericardium 6 on the opposite side. So for the female, if they are suffering with the polycystic ovary, delay or the early menstruation, any type of the problem in the which is connected to the hormones, we can work with this, right? So initially I told you for the male what we can do is spleen 4 pericardium 6 and stomach 30 bilateral. For the female, pericardium spleen 4 and the pericardium 6 CV1 bilateral, we will complete the pattern by adding these points. अगर हमें फीमेल के लिए वर्क करना है तो हम CV1 जोड़ दें और मेल के लिए करना है तो स्टमक 30 जोड़ दें. Just remember the testes and ovary. आपको ध्यान रखना है testes and ovary. What is the function of testes? मेल की आवाज बकरी जैसी निकल रही है या फिर फीमेल जैसी, मतलब मेल की आवाज में वो नहीं है, एक जो होता है ना, क्या बोलेंगे उसको, एक भारीपन नहीं है, भारीपन. Spleen 4. The person is having any type of the hormonal problem, spleen 4, having no muscles, no masculine nature, spleen 4, if we go in the female is having some problem with the hormones. Okay. Even they are not getting enough menstruation, low menstruation, any type of the hormonal problems, spleen 4 is a master point. During the menopause, there is impairment of the hormones. We will use Chong Mai. हालांकि मेनोपॉज के समय हम रेन माई का भी प्रयोग करते हैं क्योंकि रेन माई फ्रंट से यूट्रस तक कवर करती है. So Ren Mai and Chong Mai. Ren Mai will be discussed in the detail. That time we will be telling you in the menopause, the first very effective point, lung 7, kidney 6. But right now, as per the hormonal understanding, as per the hormonal connections, we can understand spleen 4 and the pericardium 6, one of the great point, right? Okay. Let's move to the next. Now we're talking about the thyroid. अब हम thyroid की बात करते हैं. Yeah, definitely facial hair. अगर किसी female के facial hair है, we will work on the adrenal gland. Adrenal gland means pericardium 6. अगर हम stimulate करेंगे तो testosterone बढ़ जाएगा. So we'll work on the spleen 4 as a master point and pericardium 6 as a couple point. Right? So it will work on the facial hair. It will reduce the facial hair. Okay. Fine. Now let's proceed to the next. ED. Yeah. So if the person is suffering with the erectile dysfunctions, with the diabetes, so first we have to work on the diabetes. पहले तो diabetes पर ही काम करना पड़ेगा. Right? So kidney 6 is a master point for diabetes. Kidney 6 and lung 7. Then we have to work. जो डायबिटीज वाले पेशेंट होते हैं कभी कभी उनमें एड्रिनल ग्लैंड ओवर स्टिमुलेटेड होती है. So what we can do, first work on the pancreas, kidney 6, then work on the Chong Mai, spleen 4. फिर आप Chong Mai पर work करिए, right? Clear? But definitely you can't forget the pancreas. आप pancreas को नहीं भूल सकते because that ED or the erectile dysfunctions has appeared with the results of diabetes. Clear? Okay. How many remaining? Yang linking vessel. Yang heel vessel. Okay. Now we'll discuss in the next class. Okay. Enough. Thank you so much, everyone. We will keep discussing many protocols and the root causes of the disease. So let's close the session. See you in the next class. Good night.